Welcome to Primal Health. Cancer is a complex disease that has affected millions of people around the world. Traditionally, cancer has been treated as a disease caused by genetic mutations, which are changes in the DNA that lead to uncontrolled cell growth. However, a new and intriguing perspective is emerging, which views cancer not just as a genetic disease, but also as a metabolic disease. This means that instead of focusing only on the genetic changes in cancer cells, scientists are also looking at how these cells use energy and nutrients to grow. We'd like to extend our gratitude to Professor Thomas Seyfried, PhD, for sharing his expertise on this topic. In this video, we will discover the fascinating world of metabolic therapy, highlighting its potential to revolutionize cancer management. We will explore various strategies that target the unique metabolic pathways of cancer cells, providing insights into how these approaches can enhance patient outcomes. Our goal is to engage and inform you about these groundbreaking alternatives, sparking your curiosity about the future of cancer treatment. Be sure to stay until the end as we uncover the promising developments in metabolic therapy and how they may change the landscape of cancer care for patients around the globe. This unique approach to cancer is important because it goes beyond just attacking the tumor, which is a mass of cancer cells. It also addresses the underlying issues in the body's metabolism that contribute to cancer growth. Metabolism refers to all the chemical reactions in our body that keep us alive, including how we convert food into energy. Cancer cells often have altered metabolism, meaning they process nutrients differently from normal cells. By understanding and targeting these changes, researchers are exploring new treatment options that could help stop cancer growth by fixing these metabolic problems. For many years, the main ways to treat cancer have been chemotherapy, radiation, and immunotherapy. These traditional cancer treatments have strengths and weaknesses, which we will explore in depth. 1. Chemotherapy treatment uses powerful drugs that target rapidly dividing cells, which includes cancer cells. 1. However, because these drugs can't distinguish between cancer cells and other fast-growing cells, like those in your hair and digestive system, they often cause significant side effects, such as hair loss and nausea. 2. Radiation therapy treatment uses high-energy particles or waves, like X-rays, to destroy cancer cells. 2. While it can be effective at shrinking tumors, it can also damage nearby healthy tissues, leading to side effects such as fatigue and skin changes. 3. Immunotherapy is a newer treatment that boosts the body's own immune system to recognize and attack cancer cells. 3. While promising, it doesn't work for everyone and can cause side effects like inflammation. Despite advances in these treatments, they have their limitations. Many patients experience severe side effects, and the success rates of these treatments vary widely. Moreover, despite significant investments in research and treatment, the overall death rates from cancer have not decreased as much as hoped. This has led to questions about whether focusing only on the genetic aspects of cancer is enough. By considering cancer as a metabolic disease, we can start to explore alternative treatments that might work better for some patients. The idea of cancer as a metabolic disease is based on the observation that cancer cells often use nutrients like glucose, a type of sugar, and glutamine, an amino acid, differently from normal cells. In many types of cancer, cells take in a lot of glucose and convert it to lactate, even when oxygen is available, a phenomenon known as the Warburg effect. This process is unusual because most normal cells only produce lactate when oxygen is low. The Warburg effect allows cancer cells to generate energy quickly and produce the building blocks they need to grow and divide rapidly. Similarly, glutamine is used by cancer cells to create the materials needed for cell division and energy production. Understanding these unique metabolic processes in cancer cells has significant implications for treatment. Instead of just targeting the genetic mutations in cancer cells, researchers are now developing therapies that aim to cut off the energy supply to these cells. This could involve using drugs that block glucose and glutamine metabolism, effectively starving the cancer cells and stopping their growth. This approach could also potentially reduce the side effects of traditional treatments, as it allows for more selective targeting of cancer cells while sparing normal tissues. One of the most promising areas of research in metabolic cancer therapy is the use of dietary strategies. Two approaches that have gained attention are the ketogenic diet and fasting. The ketogenic diet is a high-fat, low-carbohydrate diet that forces the body to burn fat for energy instead of glucose. For cancer patients, this diet is particularly interesting because many tumors rely heavily on glucose for energy. By drastically reducing carbohydrate intake, the ketogenic diet limits the amount of glucose available to cancer cells, potentially slowing their growth. Research has shown that certain types of cancer may respond well to this diet, making it a compelling option for patients looking to complement their traditional treatments. Water fasting, where a person abstains from all food and caloric intake for a set period, has also been studied for its potential benefits in cancer management. Fasting can trigger a process called autophagy, where the body starts breaking down and recycling damaged cells, including cancer cells. This can lead to a reduction in tumor growth and may enhance the effectiveness of chemotherapy by making cancer cells more vulnerable to treatment. Fasting can also improve overall metabolic health, which may lead to better treatment outcomes. These dietary strategies require a high level of commitment from patients. It's essential for individuals to work closely with healthcare professionals, such as nutritionists and dietitians, to ensure they receive adequate nutrition during treatment. Patient education and support are crucial for implementing these dietary changes effectively. They can empower individuals to take control of their health and make informed decisions about their treatment plans. Another exciting area of research is the combination of metabolic therapy with pharmacological interventions. An example of this is the use of a drug called DON, 2-deoxy-D-glucose. DON is a glucose analog, meaning it looks like glucose but doesn't work the same way in the body. It interferes with the glycolytic pathway, which is the process that cancer cells use to convert glucose into energy. Because cancer cells rely heavily on glycolysis for energy, DON can effectively disrupt their energy supply, leading to reduced growth and increased sensitivity to other treatments. The effectiveness of drugs like DON depends on the timing and dosage. For instance, administering DON before chemotherapy could make cancer cells more susceptible to the effects of the chemotherapy drugs. However, too much of the drug could be toxic, and too little might not be effective. Therefore, personalized treatment plans that consider the specific metabolic profiles of individual tumors, as well as the patient's overall health, are essential for maximizing the benefits of these drugs. Despite the promise of metabolic therapy, there are several significant barriers to its implementation in clinical practice. Many oncologists have been trained to focus on conventional treatments like chemotherapy, radiation, and immunotherapy. This focus can lead to skepticism regarding alternative approaches like metabolic therapy, which may not yet have the extensive clinical trial data that traditional treatments have. Additionally, the prevailing belief that cancer is primarily a genetic disease complicates the acceptance of metabolic strategies. This belief shifts the focus away from the metabolic dysfunctions that drive tumor growth. This resistance makes it difficult to introduce new therapies because oncologists may be reluctant to recommend treatments that differ from established protocols. They often fear that these alternative approaches could compromise patient care or outcomes. Financial implications also play a crucial role in the barriers to implementing metabolic therapy. The cancer treatment landscape is heavily influenced by revenue generation, with many medical institutions relying on the profitability of conventional treatments. Chemotherapy and radiation therapies often come with high costs, and the financial incentives tied to these treatments can create reluctance to explore alternative therapies that may not offer the same revenue potential. Moreover, metabolic therapies, including dietary interventions and pharmacological agents targeting metabolism, may not be covered by insurance or may require out-of-pocket expenses for patients. This financial burden can deter both patients and healthcare providers from pursuing metabolic therapy. To overcome these barriers, there is a pressing need for education and training for healthcare professionals regarding metabolic therapy and its potential benefits in cancer treatment. Many oncologists and healthcare providers may lack a comprehensive understanding of metabolic approaches, leading to misconceptions about their efficacy and safety. Incorporating education on metabolic therapy into medical training programs and continuing education for practicing oncologists is crucial. It allows healthcare professionals to gain a deeper understanding about the role metabolism plays in cancer. By becoming more informed, they can better appreciate the potential benefits of integrating metabolic therapies into clinical practice. This knowledge can ultimately lead to more effective and personalized cancer treatment options. Workshops, seminars, and collaborative research initiatives can facilitate knowledge sharing and foster a more open-minded approach to alternative treatment strategies. Creating multidisciplinary teams that include nutritionists, metabolic researchers, and oncologists can significantly enhance the discussion around metabolic therapy. This collaborative approach encourages a more holistic view of cancer treatment, ensuring that the metabolic needs of patients are thoroughly considered. By bringing together diverse expertise, these teams can develop more comprehensive and effective treatment strategies. Real-life experiences can be very powerful, especially when it comes to understanding the potential of new treatment strategies. By focusing on what works best for them, patients can find a path that aligns with their unique circumstances and preferences. Patients who engage in metabolic therapy often report feeling more empowered and involved in their treatment journey, which can lead to better adherence to dietary changes and a more positive overall experience. While individual results may vary, the growing body of anecdotal evidence suggests that metabolic strategies can play a crucial role in managing cancer and improving patient outcomes. As more patients share their experiences, it becomes increasingly clear that personalized treatment plans, grounded in the principles of metabolic therapy, can offer hope and new possibilities for those facing cancer. By embracing these innovative approaches, patients may not only enhance their longevity, but also cultivate a better quality of life during their cancer journey. Preventing cancer is just as important as treating it, and adopting healthier lifestyle habits can significantly reduce the risk of developing various types of cancer. One of the most impactful areas to focus on is diet. A balanced diet, rich in essential nutrients that support overall health, can help mitigate cancer risk. Additionally, maintaining a healthy weight through proper nutrition is vital, as obesity has been identified as a significant risk factor for several types of cancer. Regular physical activity helps maintain a healthy weight, improves metabolic health, and enhances immune function. Studies have demonstrated that individuals who engage in regular exercise have a lower risk of developing cancers, such as breast, colon, and endometrial cancer. Exercise can also help reduce inflammation and improve hormone regulation, both of which are important factors in cancer prevention. The American Cancer Society recommends at least 150 minutes of moderate-intensity aerobic activity, or 75 minutes of vigorous intensity activity each week, along with muscle-strengthening exercises on 2 or more days. By incorporating physical activity into daily routines, individuals can significantly enhance their overall health and reduce their cancer risk. The link between obesity, diabetes, and cancer incidence is particularly concerning. Obesity is associated with an increased risk of developing several types of cancer, including breast, prostate, and pancreatic cancer. Excess body fat can lead to chronic inflammation and hormonal imbalances, both of which contribute to cancer development. Furthermore, individuals with diabetes, particularly type 2 diabetes, face a higher risk of certain cancers due to the metabolic changes associated with the disease. Insulin resistance and elevated insulin levels can promote tumor growth and proliferation. Therefore, addressing obesity and diabetes through lifestyle changes is essential for cancer prevention. Encouraging individuals to adopt healthier lifestyle choices is vital in mitigating cancer risks. Simple changes, such as preparing home-cooked meals using whole ingredients, opting for healthier snacks, and incorporating physical activity into daily routines, can make a significant difference. Setting realistic goals, such as gradually increasing exercise frequency or making small dietary adjustments, can help individuals stay motivated and committed to their health journey. Additionally, seeking support from friends, family, or community groups can provide encouragement and accountability, making it easier to sustain these lifestyle changes over time. Dietary strategies like the ketogenic diet and fasting, when combined with traditional treatments and new drugs like DON, offer a promising approach to cancer care. Overcoming the barriers to implementing metabolic therapy requires education, collaboration, and a shift in how we view cancer treatment. Real-life stories of patients who have benefited from these approaches provide hope and inspiration for others facing similar challenges. Finally, making informed lifestyle choices, including healthy eating and regular exercise, can significantly reduce the risk of developing cancer. By embracing these strategies, individuals can take an active role in their health and improve their quality of life, whether they are preventing cancer or managing it. By spreading awareness about the importance of metabolic therapy and lifestyle changes in cancer management, we can help more individuals take charge of their health and potentially improve their cancer outcomes. Together, we can foster a community that prioritizes knowledge, support, and innovative approaches to cancer care. If you found this video informative and inspiring, we invite you to subscribe to Primal Health, hit the like button, and share it with others. Be sure to check out the links in the description below for some great products that have helped us on our journey to Primal Health. Thank you for joining us, and we look forward to sharing more valuable insights in our next video right here.